So today we are going to be doing a CE presentation um, called Weight What? Shifting the Weight Conversation. I'm going to do a couple of housekeeping items before we officially get started. Um, this will be a roughly 35, 40-minute presentation. We want to leave time at the end for Adee to answer any and all questions that come in throughout the presentation. So please, during the presentation, feel free to actively use either the chat box or the Q&A. We want the questions to come in. We'll do our best to get to as many as is possible at the end. Anything that we don't get to, we'll try to send out email communications following the presentation. Maybe we'll even have a follow-up presentation if enough questions come in. This is a great and important topic. This is a recorded presentation, so if anybody is unable to stay for the whole presentation or has people that they know that wanted to come but the time didn't work, you're always able to access the presentation vis-a-vis our YouTube channel. That said, in order to get the CE credit for the presentation, you must be here and present for the whole presentation. Following the presentation, you will be getting an email from the CE accreditation organization who will be asking you to complete an evaluation. Once you complete the evaluation, then the CE credit is emailed to you. With that said, I would love to get started. My name is Amanda Falk. I am a partner and chief clinical officer at The Dorm, which is a treatment community for young adults ages 18 to 30. And at The Dorm, many of our clients struggle with disordered eating. And all of our clients, regardless of diagnosis, work with health and wellness professionals and health and wellness team to look at their relationship with food and their body image throughout the course of treatment, which is why we're really, really excited to be here today with Adee Levinstein from Eating Recovery Center during National Eating Disorder Awareness Week. Adee will review an important framework of weight inclusivity. And at its core, this philosophy recognizes that weight-based discrimination and stigmatization can have and do have negative impacts on not only physical health, but also mental health as well. Adee is a clinical dietitian training specialist at Eating Recovery Center. Her areas of specialization include eating disorders, sports nutrition, and the intersection of eating disorders and movement. Adee is passionate about improving how patients relate to food, movement, and their bodies to nourish their whole person physically, mentally, emotionally, and socially. Outside of her active practice, Adee's experience is recognized through multiple speaking engagements on topics such as treating eating disorders in athletes, moving forward with a weight-inclusive nutrition approach, and eating disorders in Judaism, the impact of culture and religion. So with that said, we are really, really grateful and thrilled to have Adee presenting today, and I am going to turn the presentation over to you.
Thank you so much. And thank you everyone for joining us today. This is a topic that is near and dear to my heart, working specifically in the eating disorder population. But I like to say that this lens and framework is so important to talk about outside of this, just anyone that works with human beings and kind of talking about how this impacts other humans. So I will go ahead and get started without further ado. And like Amanda said, please feel free to put in questions. Love having this conversation. I do also just like to give the little caveat that this could be an entire conference, probably a year-long conference. There's so much to talk about. So this will be really kind of hopefully planting seeds or starting to have a little bit more curiosity around the topic for those that are not familiar with it, those that are maybe advancing, or maybe there'll be a little bit more that you haven't heard before, but would love to chat about it. It is definitely a shift in framework from the world that we all live in. So I have no conflicts of interest to disclose. I do like to start off with a couple disclaimers. Of course, that with my privileges coming into this conversation as a white relatively high socioeconomic, privilege with education, and also someone that is in what society considers a straight size body. So people that live in different body sizes will have different experiences than I do walking through this world. But I do think it's important that all people of all shapes and sizes are having the conversation of how we talk about weight impacts all of us and impacts those in different size bodies differently as well. I love this quote, starting off with, let's stop telling people to get over it and start asking how I can help you heal. When we talk about weight specifically, and we talk about how much really society says that people have so much control over their weight, and that it is a reflection of who they are, oftentimes is how people see it, right? Of their value, of their worth, of their willpower. We're really kind of missing the mark, and really not centering that human's experience. And not oftentimes, I actually just finished listening to a podcast this morning of a physician talking about how so many patients don't come to the doctor's office because they say, well, my doctor's not going to listen to me, or they don't believe me when I speak, right? And especially around weight conversations. This happens in dietitians' offices. I'm a dietitian too. And when oftentimes there'll be conversations of, I don't really understand why my patient's not losing weight, because they say they're doing all these things that we're talking about and something else must be going on. And oftentimes the response from colleagues, other clinicians, other providers will be, they're probably not telling the truth, right? They're probably not counting this, or they're lying. And so really thinking about how we can look at the person in front of us that's coming into our office, other humans we're interacting with, and centering their experience and really believing their experience and what they're bringing into the room. And we liberate ourselves from the expectations that we must have all things figured out. We enter a sanctuary of empathy. And this is really where I want to invite everyone to come to this presentation with curiosity and an open mind. I want to disclose that when I first started hearing about this framework, it really challenged a lot of my worldviews, a lot of my clinical knowledge and education and my training. And it can be really heavy stuff to think about, but I've been believing this, right, my whole life, and all these things that I believe to be fact. And that's really hard to start challenging kind of the way that we all talk about bodies and weight and health. So I just really want to take this moment to give you that space to reflect on that, and just know that you're not alone, and whatever comes up is super valid. And again, just inviting an open mind and curiosity around it. So our objectives for today are defining the framework of weight inclusivity. What is it? It's hard to talk about why are we talking about it? Why is it important if we're not actually defining what it is? Differentiating between a weight-centric, what is also called sometimes weight normative, and weight-inclusive language, and identifying weight-inclusive approaches to setting health-related goals. So to start with where we are, or what oftentimes we're taught, I will say what I was definitely taught in my clinical practice, and just living in the world that we live in, that if I just teach them more, and this is coming from usually a physical clinician, whether it be a dietitian, a doctor, a nurse, someone right in the medical space, if we just teach them more, if they would just listen to us, right? I'm giving them the information. Why aren't they listening to me? If they would just be more compliant, if they would just make better choices, and if they would just tell the truth, right? All of these things that if these things were to happen, then this person is going to have more knowledge, right? And that knowledge is going to lead to these changes in behavior or changes in their choices, which then will lead to weight changes, and then will lead to health changes, right? And hopefully health improvements. And then all of this equals human value. But what we actually know, for those that work with humans, is that it's a little bit more complicated than this, right? That yes, knowledge is super important, but the knowledge that we're providing is a tool and it's a resource. And also we need to observe and identify kind of the biases in science, quote unquote. The research that's out there is only as objective as the humans that are conducting that research. And we'll get into a little bit more on that sciencey side of things, because for those fellow nerds in the room, I like to see kind of the evidence. And we know that knowledge does provide more education, but also that knowledge changes don't always lead to choices and behavior changes necessarily, right? We need to also talk about intrinsic motivation and values of that human and what is important to that person, not just what's important to us as the clinician in the room talking to that person. We also know that we will talk about later, the choices and behaviors are not always going to lead to weight changes, and that weight is not directly correlated with health. And there is this kind of idea in society, and I talk to my patients about this all the time, right? That weight loss is always good and weight gain is always bad. One of the things that I like to try to challenge with my patients is, are there any scenarios they can think of in the world where that is not the case? First and foremost, with my patients, since I treat eating disorders, in a case of an eating disorder, weight loss, not a positive thing, and often, and really usually a scary thing. Weight gain, weight restoration is what we like to call it, or weight rehabilitation, really positive, really helping that brain come back online, giving the body physical nutrients that it needs. It helps make therapy more effective, right? If the brain is malnourished, therapy interventions are not going to be as effective because the brain cannot actually have enough nutrition to understand, intake, and process and utilize that really, really important and valuable information that the therapist is providing. Additionally, medication's not going to work as well when the person is malnourished, right? So both psychiatric medication that is supposed to support anxiety symptoms, depression symptoms, OCD, personality disorders, all of those things, not going to be as effective in a malnourished brain. And also physical medication, right? When there's research on the effectiveness of medication, it's typically in a nourished person. So eating disorders, not great for weight loss, not great, weight gain, great, right? Thinking about childhood and adolescence, right? When you take your kiddo to the doctor's office when they are not gaining weight appropriately as a baby, that's typically, right, area for concern. And when they lose weight and they kind of cross those growth chart curves in the downwards direction, that's also typically, that's what we call, if there's at least 2 curves crossed downward, that's failure to thrive, right? So we talk about in childhood, adolescence, weight gain is a really positive thing. That means that the body is growing and developing as it needs to, that the bones are getting the nutrition they need to form properly, the hormones, the organs, all of those things. And of course, the brain that's also still developing. And there's a lot of examples out there, but one of the things that I've very much seen in especially our pop culture and also in the medical space is when someone, God forbid, has a cancer diagnosis, that people say, well, the silver lining is that you look great when you lost weight. And when we really take a step back and objectively look at what we're saying to someone, that their body is not able to not only maintain its, musculature, its sustenance, right? Its substance in the human body, and it's actually breaking itself down because of this horrible disease. But at least you lost weight, right? That to me, again, it can be such a common thing, and it can roll off so easily because we live in this world that is so weight centric, and that weight is this thing that at all costs needs to be less, that we're not even really thinking about what we're saying, right? Or what that person is saying. So finally, right, we know that this person in front of us is a human and they have intrinsic value, and that shape or size of their body does not change that value. And when we talk to people in a way that makes them feel like, even when we're making comments on someone's body when they have lost weight, right? You look great. In that moment, it might feel really nice for them. And the other side of that message is, oh, did I not look okay before? Or am I not going to get that positive reinforcement, right? What is going to happen when I do gain weight back, or if I do gain weight back, or if my body changes in some way, right? So thinking about kind of bird's eye view, zoomed out lens of what do these comments mean? What does it mean when we really put that knowledge change? We want it to lead to weight change, lead to health changes, right? And that this human in front of us is so much more complex than the shape and size body that they live in. So this is kind of clinically and also just what we are taught just growing up in this world. And then we have the media that, goodness gracious, I could fill this 1,800 slides of all of these things. And I still wouldn't have enough space for all of the things. This is from a couple of years back, but same thing for the last however many decades, right? The types of diets change, the type of workouts that are popular change, the types of nutrients that are demonized change. But at the end of the day, it's look at the celebrity and how much weight they lost, or, oh my goodness, the celebrity that gained all this weight, or, now it's the GLP agonists, the Ozempics and Wegovys of the world that we're talking about, but it was 2 seconds ago intermittent fasting, and then right before that keto, and keto before that was called Atkins, right? And so we're always there's something else that is new. And so these messages are everywhere. And they're not just in the media, right? They're on social media, they're in our doctor's offices, they're at schools, at workplace, right? There's all the weight loss challenges, health steps challenges, all of these things about how can we change our body. And then of course, TV, Biggest Loser type shows, all of those kinds of things. And right, doctors, specifically medical providers, dietitians, lots and lots of sciencey people, right, will say, well, but the research shows that higher weight leads to all of these things or is associated with all of these things. So I'm going to take a few minutes here. Bear with me if you're not into if science is not your jam. I'm trying to make it as simple as possible because I also am like, I don't need someone throwing a bunch of jargon at me, but it is helpful to kind of really dig into what is available and look at some of the biases that do exist in research. This is a study from 2021 that actually looked at the effects of weight loss versus fitness level for reducing health risks. And I don't know, can you see, Amanda, my mouse if I'm moving it up here on the screen? Or no, I can't tell I don't know if Zoom shares the mouse or not.
Hold on, let me move because I move it again.
Do you see it?
I can see it. If anybody in the audience, okay, perfect.
Okay, perfect. Yes, you can see it. Awesome. Okay, so over here you've got all-cause mortality and their hazard ratio, and down here cardiovascular disease mortality and hazard ratio there. And then of course normal weight, overweight, and obese. I will say that I do not like using the word overweight and obese, so you can pretend I'm using air quotes every time. I just don't want the screen to get all crazy with my hands doing air quotes all the time. These words in themselves can be very stigmatizing and also signal that there is a weight or size that is supposed to be right for everyone, which we know is actually not the case. And I'm happy to speak a little bit more to BMI on our next slide. But looking at the red is our fit individuals, so those that they measured to be fit, and the blue is the unfit. And looking across all of these categories, right, both in the normal weight, overweight, and obese, the ones that are fit in all of those have approximately half of the hazard ratio for mortality, both for all cause and even I'd say less than half over here for obese for cardiovascular disease mortality. So we know that, so essentially talking about that body shape or size does not actually determine, right, our risk for mortality in this case, or other kind of disease patterns, likelihood of developing them, just as its own indicator, right? We know that there are some confounding factors, right? There might be something else that is leading to maybe body shape changes that may also be leading to other condition changes. But I think the study did a great job of seeing that someone that has cardiovascular fitness, has fitness level. I don't remember off the top of my head what their definition of fitness is, but I have the citation here and you can go back and take a look. But knowing that we are measuring one measure of a health promoting behavior, right? But not that number on the scale is actually showing to reduce that hazard risk very significantly across all body sizes. And I've got some research considerations here. This is just from compilation of a variety of different sources. But when we look at weight loss studies that show X amount of benefits, and it might be there are decreased blood pressure, decreased blood sugars, decreased cholesterol levels, we're looking at these immediate, very much short-term, not long-term interventions. And I will tell you, this is a shocking fact that I learned a few years ago working in this field, is that there is not a single study out there that shows above any type of weight loss intervention that shows the majority of its participants lose and maintain that weight loss for longer than 2 to 5 years. So essentially, this intervention that we are prescribing for a very large majority of at least the US population, but also the world population, is not evidence-based. There is not a single scientifically backed way to do it and maintain that weight loss. So when all of these measures improve in that short term, that's actually our body doing exactly what it needs to do to protect itself against danger. So if you think about developmentally speaking, biologically speaking, right, our brain is wired to keep us alive, to survive at all costs. So starvation, which is depending on the diet we're on, something that we're signaling our body is unsafe, right? You are now lacking nutrition. You are intaking less nutrition than I require to function at baseline. That's a danger to my survival. And therefore, I'm going to, in the interim, improve these markers, right? I need to kind of make up for the shift in my homeostasis, which for those of you that don't want to dig back to middle school science, that really the body's tendency to stay in balance and need to stay in balance. So it's going to shift other things in order to make up for this danger. But that's not something that lasts long term. And what we also know is that this stresses the body. Stress requires an increase, or creates, an increase in cortisol, which is a stress hormone in the body. Cortisol leads to inflammation in the body. That's not a good thing, right? And so by recommending weight loss, by engaging in very significant dieting patterns, we are increasing stress in the body, which again, cortisol in the interim really helps with these things very much in the short term, but long-term sustained high levels of cortisol increases inflammation in the body. Next is BMI was never designed to be used as an individual health marker. So for those that have heard of this before, this is probably not news. And for those that haven't, this blew my mind as a dietitian that learned about BMI and how that's something that we need to look at. And we still to this day have to document on every single one of our patients that it is an indicator, right? And a lot of us have seen the charts in our doctor's offices, pretty well versed. And if it's at least 18.5 is the bottom end of normal and 24.9 is the top end of normal, then 25 to this is overweight, right? And then we've got obese, and the obesity gets divided into different categories. BMI in itself was not even created by a medical person. And it was actually made in Europe based on statistics of white European men. So there was not any diversity included in the original numbers that were created for this. And it was really looking at a population level of literally just a ratio of height to weight. So this doesn't take into account gender. It doesn't take into account body composition. It doesn't take into account literally any factor other than you have X amount of pounds or kilograms, right? Kilograms is what it uses in the equation. You are this tall, and that is the ratio. So thinking about for all humans, right, how many different variables there are for each human body, this is not an accurate measure of anyone's health in the sense that thinking about most of our athletes that have a lot of muscle will be following in the overweight or obese category. I would argue that most people in our population would agree that most of our athletes are in a pretty solid health condition. And again, that's also a generalization that could be inaccurate, right? But thinking about the measures that we are looking at, of someone that is physically active and hopefully nourishing their body appropriately and getting a right amount of sleep and all of, managing stress and all of these things, that their BMI, if that's the marker we're looking at, is going to be showing that they are in this quote, not okay category, when in reality, they're doing a whole lot of things that a lot of people in society are striving to do. The other part of BMI that I think is really interesting, right, is when we look at studies, it again divides into usually underweight, normal, overweight, obese, again, air quotes around all of these words that I don't love using, but knowing that when we look at this obese category, we're looking at an infinite number, whereas the other ones are very discrete, right? When you have normal, it's this very discrete window between 18.5 and 24.9, and overweight is 24.9 to 25 to 29.9, right? And then you've got 30 and above. And someone with a BMI of 31 and someone with a BMI of 91 might have very different health measures, right? They are at a very different state in their body shape and size, but probably also other things that are coming along with it. And so there's also bias in that in itself, right? We're not looking at certain, 5 increments if we're going to use this generally. And then the other little fun fact that I like to share is that in the late 90s, there was a vote that was taken by a group of people. No new science was brought out. There was not any science or data that came out about this, but there were a couple people on the voting committee that also had stakes in pharmaceutical companies that also sold weight loss drugs. And overnight, they changed. They voted to change the cutoffs of BMI and lowering what was considered normal, what was considered underweight, what was considered overweight and obese. So overnight, people without changing their weight, all of a sudden now, maybe they were in the normal category, now we're considered overweight, and overnight overweight to obese, right, et cetera. I don't know. I don't love that a vote was taken in order to determine, right, these things that whether insurance companies are going to be covering healthcare for people, or if a doctor is going to be willing to have do surgery on someone that they need a knee replacement surgery, IVF treatments, what have you, lots and lots of things that oftentimes are weight-based are now changed, again, based on a vote. So there's a lot more BMI information out there of why it is not a good measure, but wanted to give you a few pieces to start with. And then the financial stakes in the weight loss industry. So the weight loss industry is an this number keeps changing. It was $87 billion, I believe, right before the pandemic. Then the pandemic had a little shifts because doors closed to things, but then of course we know that things are continuing to change. But it's an $80+ billion industry that thrives on us as humans always thinking that there is something we need to do to change our body. We need to control the way that our body looks, and that no matter where we are, we always need to do something different, right? And that when the product doesn't work, it is not the product's fault, but it is the human using that product's fault, right? And there's just an analogy that I like to use with it is like if you were to do a puzzle, a jigsaw puzzle, I'm a big puzzle fan, at home, and you finish the puzzle, but there were 3 pieces missing, and you email the company, they wouldn't tell you that, oh, we actually think that you didn't try hard enough to finish that puzzle, right? They sent you a defective product, they're going to send you a product replacement. And I can vouch this did happen to me, and they did send me a product replacement or gave me a code to order another one. But in the weight loss world, right, if a program or a supplement or a medication or what have you doesn't work, it's not, oh, this was obviously not a good product, we're so sorry, here's your money back. It's you must not have tried hard enough, or you didn't really want it enough, or did you really follow this plan appropriately? Sounds like a you thing, but here's 18 other things that you can pay money for, right? So there's a lot of this financial gain in people never being satisfied with where they are and thinking that they need to continue losing weight. In the research, there is a lack of population representation in both in the eating disorder world, but also in general health science research of who are the people that we're looking at data of health status of people at different shapes and sizes, right? Different people. There's just not a lot of research as far as different ethnicities, different races, different backgrounds. And so when we are looking at health markers, and this is the range at which we think a weight needs to be, or body composition or things like that, we're not looking at a representative sample of the population. And then effects of weight cycling and weight stigma are not considered. So there's actually studies, I did not pull any for this specific one, but there are great studies that show that weight stigma in itself is more harmful for our health, physical and mental health, than any weight on the body actually is. And so when people don't feel like they are experiencing stigma because of the body weight that they are in, and that can be internalized stigma from themselves or from people around them, that impacts their health. And of course, linking body size and health status to that individual worth versus all these other factors called social determinants of health that might affect their physical and mental well-being, right? And so this is a great pizza slice infographic that a dear colleague of mine, Leslie Schilling, made based on a research study that shows our social determinants of health. And looking at this, I again love using this one with my patients because it's a great visual. The thing that we are mostly focusing on in our world for health is this little guy right here, right? Diet and exercise, which, don't get me wrong, I'm a dietitian. I think that nutrition and movement are huge parts of our health and really important things to talk about. And we cannot talk about them in isolation of all of this, right? Looking at this, it's about 30% for all of these health behaviors together, meaning diet and exercise are somewhere less than 10% of our entire health. So if we're not talking about someone's job status, education, their family, their social support, connection, right, community safety, their income level, their physical environment, their access to healthcare, and all of these other things, this nutrition and exercise piece, while again, not completely irrelevant, is not really going to significantly impact their health if all of these other things aren't in place. So when someone is working 3 jobs, right, and caring for their children and doesn't have time to sleep and is really stressed, going to eat one more vegetable probably might not be the thing that's going to affect that overall health picture. And actually studies are showing too that it's not in this one, but that weight stigma in itself can be considered a social determinant of health. All right, so I promised we would define some approaches. So our weight-centric or normative approach is this conventional approach to health that suggests weight and weight management, primarily weight loss, are the primary determinants of health. And again, thinking about doctors' offices, how many people go to get a flu shot or go to get, even during COVID times, right, a COVID test, and like, let's step on the scale. And now we're going to have a 20-minute lecture on why we need to lose weight when all I wanted was my freaking vaccine, right? So we'll talk a little bit more about what weight-inclusive care looks like, but it is medical approaches that emphasize health and well-being without emphasizing weight loss. So I really like to kind of emphasize that this weight-inclusive approach is not saying that health is not important. The opposite is true. It is saying that health is so important, and when all we're talking about is that number on the scale, we are missing such a big part of the picture. So what does weight-inclusive care include? It talks about health-promoting behaviors. So beyond, right, are you nourishing your body adequately, and are you moving your body, right? Both of those are also health-promoting behaviors. And you could adequately nourish your body with a variety of foods and move your body in a way that feels good, and also get enough sleep and go to therapy, right? Manage that stress, have great connections, do values aligned activities, right? All of those things. And that number on the scale would never change. It could stay the same, right? And that doesn't mean that all of those things are not providing some sort of benefit or a lot of benefit for that person. It is really person-centered. So again, thinking about, I love the idea of, let me do this physical activity because there's another activity I want to do. So for those that maybe have grandkids, I really want to be able to sit down on the floor and play with my grandkids, right? I want to work on my mobility and I want to work on my strength so I can pick them up and take them to daycare, right? That is an awesome goal to have that has nothing to do with the scale and super person-centered and values aligned. And that is going to be something that a person, if they're waking up and saying, I'm going to go take my 10-minute walk today because that means that I'm probably going to have an easier time playing with my grandkids, how much more sustainable and intrinsically motivating is that than, well, if I walk those 10 minutes, that number on the scale is not going to change anyway, so why would I do it, right? Or I'm going to be really curious about what this new vegetable might taste like that I saw at the grocery store because my daughter was asking me to bake this new recipe of grilled vegetables, and that would be a cool thing to do together, right? So thinking about what is this person in front of you valuing and who is in front of you, right? And also thinking about what would it be like to redefine what success looks like with these health promoting behaviors. Because someone having less stress in their life, right, also likely means that they're more present to have connection with other people, which also means they're probably going to sleep better. Then their hormones are going to be more regulated. They have better digestion, right? All of these things work together in tandem. But if that number on the scale is really the only thing we're looking at, we're missing out on so many positives, and we're likely not going to see sustainable behaviors, right? Because if that number is not changing, I'm not going to continue doing it. And that number often doesn't change, or it does change until it doesn't. And then that makes the changing of behavior really, really hard. So some possible outcomes of weight-centric versus weight-inclusive care or language. So we see that with weight-centric approaches, there is more likely to be healthcare provider avoidance. So like that example I just gave of, you go to the doctor's office, all you want to do is just get your annual checkup or vaccines or whatever it might be, but then you end up with a 25-minute lecture on how the weight is really in this BMI category and we really need to lose weight and have you tried this and what are you eating and all of that, right? That brings up a lot of shame, a lot of guilt, and a lot of, I'd rather just not come do this, right? So when we think about those studies on, people in larger bodies are more likely to have negative cardiovascular health or high blood pressure or renal disease or whatever it might be, do those studies take into account that maybe those people are not going to get preventative care because of the care that they're getting, right? And that weight stigma, when we talk about that as a social determinant of health, is if they're not getting access to quality care of someone that is not having that stigma in the office, then they're less likely to catch things as they're developing. And there are people that go to the doctor's office and say, this really hurts and this is happening. And the response is, and I'm sorry, I don't mean to just single out doctors. That's just easy to do because that's who that's kind of the authority on health. But this happens in all kinds of people's offices or with friends and other clinicians. But if the response has often been, well, just try to lose weight. That is the reason that XYZ is happening. And there's been cancer diagnoses that are missed. There's been other types of like hormonal diagnoses that are missed broken bones. Someone said they stepped down from a curb and twisted their ankle and went to their clinician, who told them that if they had lost some weight, then that wouldn't have happened, which I don't know. I know a lot of people in different body shapes and sizes that have twisted their ankle stepping off of funny things, right? We know that weight-centric environment can lead to more disordered eating patterns. If we think we need to control our body, we're going to probably want to control that eating. That leads to some disordered patterns, increasing that shame and guilt. And like we just talked about, abandoning new behaviors due to that quote failure. That number on the scale didn't change, therefore this new behavior is not giving me any value, if that's the only thing that is measured as success. And reducing attunement with body cues. So again, maybe I'm feeling really hungry, but that diet that I'm on told me that I already ate the amount of calories I can have today. I'm going to start ignoring what my body's telling me, or I really need to sleep, or maybe I'm really tired, but man, I haven't gotten in that exercise that the program says I need to have today. So it's really starting to disconnect, right? I'm going to be doing this behavior because something external told me I need to do it, and not actually listen to the cues that my body has. When we shift more into that weight inclusive space, we're really starting to have that appreciation for body diversity. And I didn't include it in here, but for those of you that have access to YouTube, look up after this poodle science. It's a 2.5 minute video. Awesome way to kind of take a look at all of this in a cute video, but essentially appreciation that all humans come in different shapes and sizes, and we can have that appreciation that we're not all meant to look exactly the same. And it would be really boring if we did. Reducing disordered eating patterns because of that last bullet point of more attunement to those body cues and knowing what my body is wanting. Yes, I'm hungry. No, I'm not. I really want something crunchy. I really want something smooth. I really am wanting a vegetable right now. I really want that juicy burger. And none of those are good or bad. I just need to listen to what my body is asking for. Increased self-compassion, right? And I don't know if you guys have picked up on that nuance of that curiosity and self-compassion around what is happening, right? How do I feel when I take that 10-minute walk versus I can't wait to get this walk over and step on the scale and see if my weight changed, is a very different way to be curious, to add some or even, hey, I'm tired today, but I know I'm going to do that walk tomorrow because I'm so excited to play with that kiddo that is going to come over after school. And more likely to choose sustainable behaviors because they are values aligned and not because it's for this, again, extrinsic motivator. And before I wrap up, I love to talk about the nuance of language. This is not something that we can, fully cover in here. There's so much little nuance in the way that we're talking. But thinking about this is an example for food, but we can also extrapolate this to movement, to bodies, to all the things. Food is not good, bad, right, wrong, healthy, unhealthy, toxic, addictive, forbidden. Food is nourishing, satisfying, unsatisfying, tastes good, doesn't taste good, right? Filling, crunchy, creamy, salty, sweet, right? We can have very neutral approaches to talk about it. And same thing, our bodies might feel really energetic, or movement can be energizing, or it can feel really depleting. Our bodies are not good or bad. Our bodies are there to support us. And I do think that that shift into that language of how do we move into some more compassion and less of this criticism, it really helps kind of align with those values and tune into what our body is needing. So if we take away anything, I hope some of these kind of are ones you can pack up and go home with. That weight stigma really is harmful. And when we focus on values aligned behaviors, it supports increasing that self-efficacy for the person to say, I am capable of making these changes that I want to make because they're important to me. Changing behaviors can promote positive outcomes regardless of change in weight status. So we know that if someone does, right, maybe start going on a walk or reduce that stress or have positive connections in their life, that can impact positively their physical and mental health without that number on the scale ever changing. And we know for sure one of three things will happen when they engage in those behaviors. Either the weight's going to go up, or it's going to go down, or it's going to stay the same. But if that's not the outcome we're measuring, then we have so many other measures of success that we can focus on. And really every single body deserves respectful care. So another couple quotes. I'm a quote gal if you can't tell, but I really like these Maya Angelou quotes. So do the best you can until you know better. And then when you know better, do better. This one I held really tightly as I was learning this type of approach, because again, not the approach I was taught in or clinically trained in. But once you know better, you can absolutely do better. And we were doing, I was doing the best that I could with what I had beforehand. And now I have so much more, and I'm so grateful for that. And I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So, what would it be like to be that first clinician that is there to listen to this person and not ever bring up, right, that shape, body shape, or size as kind of a defining factor of their human value? So, with that, we will open it to questions.
Thank you. Thank you so much. That was wonderful. That was wonderful. And we definitely have some questions coming in through the various different mechanisms. So I'm gonna start throwing questions at you.
Great.
So I'm gonna try to go as much as I can in order to be very fair. We have one participant who's asking, what do you say to a younger client when they feel overweight compared to their peers who are, quote, thin? How can we help normalize body size in the youth that we see?
I'm going to have to, I really want to share my screen again on something else real quick while I'm answering this question, because oh my goodness, I really wish we did better for our entire population across the spectrum, but especially our growing kiddos. We do them such a disservice. So I'm going to just share a growth chart real quick. I do this education with the parents I work with, but also the kiddos I work with. I'm going to pull up a growth chart. This is a CDC growth chart for girls age 2 to 20, and I'm going to zoom in so you can see it. So typically, I'm just going to do this in a very quick manner because I know we only have a few minutes for questions, but I'll typically ask them and have this in an engaging conversation, right? On this height, this stature is height. What age approximately does height plateau? And it's usually around this like 14 to 16. Every person is different based on genetics, right? But height, at some point, we stop growing vertically. And we scroll down to weight, and at what age does weight plateau? And sometimes they'll say, oh, I think like 17 or 18. But really, if you're looking at it, the rate of growth slows down once we hit puberty, right after we hit puberty. But we don't ever, right? Someone that is, let's say, 50th percentile at this age 20, they are not the same weight that they were when they were 16, right? And that bodies are meant to grow through adolescence and through our early 20s. And probably my very non-scientific evidence, but more clinically, my knowledge base from my experience is that human bodies do continue to grow and change throughout the entire life. So if we were to continue that beyond the age of 20, the body is going to continue changing unless we're doing these very, weight-centric approaches to managing it. So I think I would say, but of course, all of this knowledge, like we said, knowledge doesn't lead to necessarily behavior or thought changes. So my number one response is sitting and validating that is really hard. It's really hard to be in a shape and size that is not the same as the rest of your peers or what feels like the rest of their peers. I'm hopeful that they are in a space where there is some body diversity, but also knowing that needing to nourish their body for the body that they have, right? That every human has different genetic patterns and every human's body needs different things. And for them to be at a size that someone else's might not be, right, fully meeting their nutrition needs and movement needs and all of those things. So I'd say number one is validation and a lot of empathy and being there with them, but also that education of like every human body is different and your body is meant to continue to grow. So also celebrating when the body does do what we want it to do.
To piggyback on that, I'm thinking a little bit too. A lot of providers who are on this webinar work not necessarily only just independently, but within like milieu treatment settings. So if you're getting a client, and this could be of any age, this could be a 16-year-old, a 25-year-old, a 5-year-old, or a 50-year-old who is sort of utilizing weight-centric commenting on, their body, their shape, their size, somebody else's. How would you suggest, intervening in like let's say it's within a group or in a community milieu setting?
Yeah, so if it's something that we know is going kind of anticipate happening, it's helpful to have along with other group guidelines, right? Like hey, this is a space-free, this is a, judgment-free zone, and that includes comments about ourselves and about others. But I think that redirecting that, of like the adding that compassion, or I think really in that moment to avoid shaming that person, right? We will probably just redirect away from that conversation. But I think it might even make a great topic, for the next milieu of like, of body conversations and what that sounds like. But having a, ahead of time of like, we're not going to talk about weight or numbers or size and body shapes in this group, just for safety of everyone in the group.
The next question that came in is about Ozempic, which is, quote, high in the media right now for those who want to lose weight and are not diabetic. Seems like it may be connected to big pharma, financial stakes. Have you discussed this with your patients? What is the best approach around this discussion?
Yes, I have with my patients that they've brought it up, especially the off-label ones that are used for weight loss. Kind of like all of our weight loss interventions, there is no long-term study on the effects of Ozempic for someone that does not have diabetes, and we're not looking at their insulin resistance. So it is a medication that is effective for those that have type 2 diabetes. It is one example of a medication that can use, not the only one, and that from the studies that are available, people do lose weight and then they gain it back and regain more. So that's the data that we have right now. I also actually just finished listening to a podcast this morning with a physician who was talking about knowing that it acts on the pancreas and making it release more, kind of change the way that is, and I'm not a doctor, so I'm not going to pretend to be one, but changing the way that it's essentially functioning. She said there's not the research on it yet, but it would logically make sense that we don't also know what kind of effects long-term on the pancreas that we would be having. So physiologically speaking, we just don't know all of the theoretically negative side effects, and there are no benefits to the medication aside from short-term weight loss, which then from the research we do have shows that it will lead to rebound weight gain.
Right. Awesome. I love this question that's coming up because I think it's a question that I certainly struggle with in many aspects of practice. But given that most of the social determinants of health have macro social causes, how can providers support clients on more than just a one-on-one individual level to stop the cycle? How can providers promote macro level social changes that will overall benefit a client's well-being? So sort of like an advocacy question.
Yeah. Oh man. Well, I would love to connect and see if we can brainstorm. Sometimes I tell my patients or my colleagues that I just want to stand on the rooftops with a megaphone and just yell at yell the things to everyone of like, we need to do this better. Because I just want to send so much compassion and like understanding that it gets overwhelming. So I do think that knowing that what we're doing is making an impact, right, in those one-on-one conversations, but also, every person with their capacity, can we join an advocacy day like on the Hill? Can we join a group that is then going to advocate for the passing of a bill that changes things? Can we talk about, advocating for, there's, maybe lawyers that are willing to donate their time or with paid time to talk to health insurances about, better coverage or whatever things are happening. But I also, people that are doing more like safe, like cleanup days for, environments. And oh my goodness, there's so many like, substance use, safety, prevention type things. So I think the options are endless, but I also want to, if it's validating at all, say that I wish I could do it all. And I know that I can't. So I also just want to put that out there that we also need to protect our own bandwidth so that we can do the important work that we're doing. While I also think it's important to have these conversations with our patients in our offices for their validation, right? That like when they get frustrated, when they're like, I'm not able to do all this or make these changes, to also show them, right, all of these systems that we're all living with that are affecting certain people disproportionately than others, right? And that it would make sense that this is not a one-to-one, right? I do this and this is the outcome because of all of these things. So sometimes even that feels helpful just for validation purposes, and that they feel seen and heard.
When taking a health history, I tend to ask, quote, how is your nutrition? What do you think? I ask because in order to learn and heal, we need nutrients.
Love it. Is
Love
that a
it.
question or a statement?
It's a question. What do you think is the
Oh,
question?
what do I think? I think that's a great, what part of it, I guess, is the question.
I think that there was, in the way that I'm reading it, it's so hard when we can't have the participants raise their hand and talk, but the way that I'm interpreting it is when you ask specifically, how is your
Oh,
nutrition? How do you
okay.
feel about that like question towards a client?
I think it's a great screener question to then ask more, right? So if they say it's good, I would then ask, what does that mean? Maybe how often are they eating a day? Are there any foods? And again, depending on what your profession is and what kind of the purpose of that meeting is, of course, you might ask more or less questions, but maybe like, you know, how is your nutrition and how do you feel about the way that you eat, or are you ever eating in secret? Maybe throwing in one or two more questions to kind of get a little bit more identifiers, because someone might say my nutrition's great and all they're eating is vegetables, right? Which some people in society do think that that is a great way to eat, and we actually know that that is not probably sustaining their energy needs. So probably adding like one more modifier or like descriptor in there to kind of get a better gauge.
Got it. How do you approach working with families, specifically parents, who are not being, weight inclusive, affirming in the home where the client lives?
I would say, first of all, that this is super common. When it is not the case, then I'm really surprised when someone walks in, they're like, yeah, I'm totally on board with that weight restoration goal. I actually want them to weight restore more than you think, right? Like, that's awesome, and almost never happens. Because parents also live in this world that we all live in, and they've been getting the messages that we've all been getting. So it's a lot of validation. For those of you that are familiar with EFFT, and again, I'm not a therapist, but I love using therapeutic modalities in conjunction with the therapist I work with. So emotion-focused family therapy has the analogy of the tree that has the kind of therapy interfering behaviors, and then the roots that might come from that. So typically, the parents in my office have a lot of fear or maybe guilt or shame or things like that. And so talking about how it would make so much sense that this feels like a recommendation that doesn't align with what you think would make sense, right? Because we've had all these messages about body shapes and size, and you're so worried that your kiddo is going to actually end up getting worse if we end up weight restoring them, and because you don't want them to be bullied in school. And all of these things are very real, right? And then also providing that really, again, compassionate education about growth charts and how your child is not going to have as effective of therapy or medication interventions, right, if they're not nourished, and how important it is for their physiology to continue growing with that nourishment. But also, again, it's that balance of we need to educate, but also if they don't feel like we're hearing them, then they're not going to listen. So being really, really empathetic and validate that it is such a hard message to be hearing. And oftentimes it takes way more than one conversation to get there. Just like when I first heard this, my ears perked up, but also I was like, this is wacko, right? And it takes time to kind of really integrate the different pieces of, oh yeah, this is the part that we've been missing, right? If it was just about eat less and move more, like our world would not look the way that it looks right now. So there's just so much more to it. And remembering that they're human that have been hearing these messages from every direction too.
I'm going to try to get one more in quickly before we
Sure.
end. Okay, how do you recommend meeting folks where they are at if wanting to be where they're at is wanting to lose weight, and not losing them by what they perceive as you trying to talk them out of that goal, which they really, really believe will change their comfort with themselves, their body, their relationships with others, etc.
Another awesome question. I think again, the like nuance of the what you would actually talk about would differ depending on what your profession is. But again, I think I would want to ask them, I'm a big values person. So asking, what are their values if they've done those, if they haven't done a values card sort of haven't figured that out. And I would send them to their therapist and say, that would be an awesome thing to talk about in therapy. But also talking about what would their life look like in this, imaginary space where their body looks different, and what are the things essentially that they're not experiencing now that they would then. And it's not that, I mean, they're welcome, right? They have autonomy, and every human is autonomous. They're considered, assuming they're an adult and get to make their own decisions, right? So they can pursue that intentional weight loss. I, as a dietitian, don't have any science that shows that this is the way. So I can't give them something that says this is how you're going to lose weight. I'm here to walk alongside you and support you in your journey, kind of to be a sounding board to talk about how things are going. But I really like to think about what are the things, I want to improve my cardiovascular health. I want to have more friends. I want to, sometimes we do get to, when we start unpacking and removing layers, it really gets to some core beliefs of like, I'm unlovable or those kinds of things, which again, as a dietitian, I will be like, wow, that it would make a lot of sense to me that it feels impossible to live in this body if you feel like no one can love you in this way. And that's something that I would then pass along to the therapist, because of course that's not in my scope, but also holding a lot of space for it makes a lot of sense, and starting to bring different pieces of, if it's something more of like, I want to improve my mobility, or I want to whatever, like, are there things that we can work on, and what if that weight weren't changing? So a lot of curiosity, I guess, is what I'm getting at. Validation, right. Curiosity. And at the end of the day, they still get to make their own decision. I just am not going to be like, here's your weight loss meal plan, because that scientifically, proof wise doesn't exist. So
thank you so much. This was wonderful. Thank you to everybody who came and participated so actively in the Q&A. You all will be receiving a follow-up email, which will pave the way for obtaining the CE credits. So keep an eye open for that. As I mentioned in the beginning, this whole presentation was recorded, will be up on YouTube. On Monday, it will be up on the YouTube channel for anybody who wants to revisit it or share with anybody else to watch. Thank you, Adee. That was amazing. Thank you, everybody, for coming. Have a wonderful rest of your Thursdays.
Thank you all so much. Have a great one.
Thank you.